Welcome back to the channel with me, your host, Dr. Debra Durst, and I have a special guest on today that's going to talk to us about hair restoration. So, James, welcome. This is James Bartholomeusz,
Hi,
or
everyone.
James Muse for short. I wasn't sure whether I would get that one out, but welcome to the podcast. I would love for you to say a few words about what you do, what you specialize in, your product, and how, we're connecting and going to talk about it today.
Yeah, I'll do the very short version. Simple one. I'm a son of a plastic surgeon. I grew up in an operating theater. I gravitated towards energy-based devices. So I've actually been developing laser technology for the past, or since I was 18. Actually, it was the first laser I developed. So any energy-based device, ultrasound, RF, laser technology. That's what I mainly did. And then around 2012, I started losing my hair. And of course, being in the laser space, I mean, I've got access to all dermatologists I could possibly ask. So I go ask all these dermatologists, what can I do about my hair? And they say, minoxidil and finasteride. And I was disappointed with that answer uh, because I thought there was something, it must be something better. 2012, and then at that point I said, well, I do have a degree in organic chemistry, so maybe I should think about that for a little bit. And by 2015, had created KeraFactor.
Well, I love that story because those are the usual answers that people get still. We hear that every day, and they'll come in and they're also on Google, as you probably are well aware now, and treating them their own hair loss with
Right.
things that can be dangerous. So I'd love to talk about again what you have and what you're passionate about for hair restoration that people can use.
What I found was, of course, I did my research, right? And there's so many lotions and potions and everything from Paris, and it's just kind of like the skincare industry, right? We have this skincare industry that started off with like baby oil or petroleum jelly, and now we have all these different grades of skincare, and you can go into a medical office and you can buy medical grade skincare, and we assume or we hope that medical grade skincare has actually real active ingredients that actually interact with your tissue. And I looked around at the hair market when I was losing my hair, and I tried to find products that were like that. Where's the medical grade fertilizer, right? Like, where's the medical grade skincare for the hair? And there wasn't any. And well, there wasn't any what I would say legitimate ones. And so, me being a laser guy, I took a little bit of a different approach where most people combine a bunch of different things. They buy some herbal remedies, maybe some real active ingredients, some real synthesized ingredients, and they kind of mix it all together and put it into a cream or a lotion or a potion, and they put it on, and they work. So they do something like inject PRP or do something like that. That's not my stream. Like, that to me sounds completely unreliable. It sounds like you wouldn't have a clue what, if anything's working, what's working. And so what I decided to do is I went, no, I'm going to go step by step. Firstly, I know that growth factors are going to be the most important, right? So if a hair is growing, and this is an important distinction that we'll talk about in a second, if the hair is growing, it needs growth factors in order to be its best version of itself. And so what I went out to do was I went out to find growth factors that could be very supportive of the hair when it's in the growth phase. And in fact, in our second generation formula, I found a growth factor or a protein called follistatin that actually elongates the anagen, the growth phase. So I could basically pump in these, basically like fertilizer, but each one was specific. It wasn't like a big clump of them. You do use them all together, but each one is individually concentrated. Each one is individually wrapped in a nanoliposome, and each one has its own mechanism of action. Now, there's some synergy between them, but they had to fight for their existence in the formula. So each one had to have their own strong mechanism of action of doing something to the hair. And then they won. And then once they won, we had to work out what the concentration should be. And then we wrapped them in the nanoliposomes. And then eventually they get combined together to be the final formula.
And this formula that you're talking about is KeraFactor,
Yes.
right? And so this has a combination of those growth factors and some peptides too. Is that
Well,
correct?
okay. But this is a very I won't say it's controversial, but it's one of these things where people don't. It's one of those words that's like interchangeable. So there's peptides, right? So the peptide just basically a branched chain amino acid, right? So you've got a bunch of lattice structural network, and there's 89 of them, or there's 191 of them, and if they happen to act, look like, and act like human versions or even plant versions of growth factors that you have in your body, we call them growth factors. But what they really are their biosynthetic peptides that look, act exactly like the growth factors that you have inside your body. And what I would tell people is there's one special thing that you need to look for, because if you look on the label, it's not going to say VEGF, vasoendothelial growth factor. It's going to say oligopeptide dash 4, right? It's going to say a peptide name. And because that's the peptide, the cosmetic peptide, that is the bioidentical version of your own thymosin beta 4. So what you're going to look on the back of the bottle is you're going to see polypeptide, polypeptide, polypeptide. But the most important thing is what are the two letters before it says polypeptide. If it just says polypeptide, it could be from a plant, it could be from an animal, it could be, you don't know what it's going to be. If it has an S and an H in front of it, that means synthetic human, which means it's bioidentical. They call it biomimicking, actually, biomimetic, biomimicking of your own production of that particular growth factor. So when we talk about growth factors, or when we talk about the polypeptides that are in KeraFactor, every single one of those are SH polypeptides.
So again, I think that peptide, yes, from what you're saying, and we know to be the case, is controversial. But usually the people that are watching are actually progressive minded and they're looking at all these peptides. And so
Right.
they know how effective, and insulin being the first one way back. So I get what you're saying. I learned something right there. The SH, I
Mhm.
didn't know that. And going back to the TB4, because
Mhm.
TB4 is known to have, hair growth stimulating properties. And, they had taken it off as well for a little while there, in an injectable form, something different.
Yeah.
But I
Yeah.
love TB4 and all the studies
Yeah.
just in that peptide alone. So just the fact that there are peptides that act like growth factors and you have your own special formula of
Yes.
them. So they work together in the right
Yeah.
concentrations. And so,
Yeah, think about it like this, like a funny story. So, like we have epidermal growth factor in a polypeptide form in our formula, and you go, oh, epidermal growth factor, that should be pretty like bioavailable, right? Because the first thing that it's going to touch is the epidermis, and surely it's going to be really bioavailable. Turns out it's not very bioavailable at all. So what you have to do is you actually have to find out, you have to get each of the peptides, you have to get them into the epidermis, and you have to check their bioavailability, and based on each one's bioavailability, you change the concentration of each one. That's what's unique about our formula is I can say I'll have 100 parts per million of this and 50 parts per million of that and 5 parts per million of that. I don't have to worry about, and they'll be absorbed independently of each other. And so I can get the right concentration of the polypeptide If it has to be high, it's high. If it doesn't have to be so high, it doesn't have to be so high. And that's what allows us to have a formula that doesn't cost $1,000. Because if I just used it all at the highest concentration, you'd never be able to afford the thing.
But really, what you want to just make sure it's getting to the target tissue, and so delivering the right concentrations.
Correct. Yeah, exactly.
All right. And so do it brings me to, again, it sounds like a lot of laboratory investigation. And so are there studies that, kind of look at these growth factors and or clinical, results related to the results, the growth of
Yeah,
hair?
absolutely. So each one of our growth factors in now, this is before I had actually formulated and we have our own studies. Okay. So when I was searching through growth factors and trying to find which ones to pick, I wanted at least two or three published clinical studies, peer reviewed clinical studies that showed its effectiveness for its mechanism of action. So let's go back to EGF. EGF should increase the amount of keratin secretion in your body. So we looked to make sure there were studies that supported that. And if there were enough studies that supported that, then that meant that would be a polypeptide that I would use in the formula. And we started with 20 different growth factors slash polypeptides. And now we have 8 in the formula, depending on which formula it is. Our first formula had 7 different polypeptides, and that's all we have. In the take home products, you have some things that help with circulation, like arginine and copper tripeptide and other things like that. But if you look at the medical formula, the one that we use all day, every day in a medical office to do a procedure, that's 100% growth factors in there with some water. That's it.
Well, it brings me to an important point with that because people are online. We get patients, that come from online sources because they didn't feel better, trying peptides. But even just the online sources, period, there it hasn't been studied. You're saying basically they can label it to be confusing and they don't know the concentration and we don't know whether we're getting anything effective in it when you're just buying a untrusted product.
Well, yeah, well, I could say, hey, here's JB006 peptide and put it on the label. Okay, and that doesn't mean anything. It could be a peptide, it could be a great peptide, but the point is that it should be, at least from my perspective, we look for synthetic human polypeptides that we know for a fact work in human skin. So we're not like guessing. We know they already exist. We're just amping up what you already have or what you might be deficient in because your hair's been falling out or your hair's getting thinner. We're picking stuff that we know is going to rebalance the concentration that you have in your scalp to produce better hair. And that's different than coming up with some fancy peptide in a university and saying, "Oh, we think this is gonna work," and totally reverse hair loss. We're not taking any chances. We're using the stuff that you already have, but we're making sure that you get the quantity that you require, that your body requires to make your hair as best as it possibly can be.
And so this brings me to a couple things because obviously people are going to watch tons of different sources with different people, saying what sounds to be good no matter what. But
Yeah.
the results speak for themselves. I've seen, a lot of and talk to different providers also. And then we'll get to also a delivery we use with KeraFactor,
Mm.
which also makes it even an enhanced, effectiveness. But so basically, what kind of clinical results, where could they go to see some of those clinical before and afters? What would you recommend that patients
So
go to
so
look for results?
Yeah, so, well, in the beginning, I would say, like, you can go to our website, mycarefactor.com, and you'll see a bunch of before and after photos. You'll be able to download and look at the first clinical study that we did. But to be honest, we have such a following now on social media and a lot of people using the product. some of the best before and after photos, just type in hashtag KeraFactor into Instagram and you're going to be flooded with before and after photos. You want before and after photos, go on social media and find them. And they're not going to be from me. They're going to be from
Mm,
all of our accounts, probably from you. You
yeah,
know, they're going to be from people who use the product, which I find much more exciting and makes me much happier to
yeah,
see real results from real doctors
yeah, and
that are
less
posting them online.
less work. It's like all that work up front. Remember what they say, like you do a
Yeah,
lot of
well,
work
yeah,
now for less work later. Now everybody else is,
you got to do the
promoting.
study. You got to do the studies, right? You
Yeah.
have to do things under a controlled environment. And
Hmm.
so we do the studies. We've got two studies that are going to be coming out very soon. One from the University of Hamburg and one done by Dr. Ziering. He's a celebrity hair transplant specialist here in Los Angeles. And they're going to be coming out very, very shortly. So there'll be a couple more peer-reviewed papers that will be coming out that were done under a very controlled. So you also want to look for controlled studies. But if you just want to see if the product works, just go on social media and type in KeraFactor, and you're going to be flooded with people sharing their experience.
Great advice and very simple. I think everyone gets that part. So when it talks, because obviously a ton, if I would say everything about like hair restoration, but even when it comes to the transplants, what are the transplant doctors doing with a product or hair restoration treatments before or after a hair transplant when they use it?
They're doing both. And when you understand what KeraFactor is actually doing, is it's really rehabilitating the scalp. So think of the scalp as the soil in your yard, or, I've used this analogy before, but imagine you have all of this grass in your backyard and you have a bunch of weeds and there's all this brown stuff around the weeds because they suck up all the nutrients in the soil and the water and everything. And so you have these brown patches and you can go and pull out the weeds. That's like the DHT, right? You go and pull out all the weeds and you get rid of the weeds and then you wait and you wait and you wait and you wait, and hopefully the hair grows back. Well, KeraFactor is the fertilizer that you would rub into that soil or roll into that soil or deliver into that soil, which I know you have a delivery mechanism that you like. And you're getting the fertilizer to the grass to help it to grow. And that's what KeraFactor is basically doing. So you've got to think about it in those terms. Now, when you think about transplants, you're dealing with people that have lost a lot of circulation in their scalp. So somebody like Ziering or any transplant surgeon that's using KeraFactor, they look at it as a pre-treatment to prime the scalp to make it as healthy as possible to receive those new grafted hairs. And in addition, when you finish the transplant, those 2, 3 months after the transplants where your hairs are the most vulnerable, you want to juice them up. You want to give them as much fertilizer as possible. So KeraFactor works on both sides of those and should be used on both sides of those.
Well, that makes sense. And I love hearing that. I have a question that I don't know the answer to. In post transplant, if you were doing a delivery system like we frequently do with a non-transplant patient, can you do that after a hair transplant?
Yes, you can absolutely do it. You just want to wait about 2 weeks to a month. I personally say a month. Now, Dr. Ziering would argue with me. He says that the grafts are settled by 2 weeks. I like to say a month. So in our literature, we say wait a month, and then you can start doing your own delivery system, which is gentle anyway. Just remember, the delivery system is not designed to go into the dermis. The delivery system is designed to go into the epidermis. And this is a little secret that nobody really understands too much about, which is the epidermis is the key in getting the growth factors to the hair. Because you inject something into the dermis, how does it know how to go over to the follicle? It doesn't. But your epidermis wraps around every single hair follicle that's in your scalp. So our delivery mechanism is the epidermis. So we don't do things deep. We do things very superficially. We make little channels in the epidermis so that we place the product in the exact best way. The only other way that you could have a better delivery of KeraFactor is if you injected it into every single follicle one by one. The next best way is the way that we do it, which is through the epidermis, not the dermis.
Okay. And so that brings us to the delivery system. Again, I will explain to viewers right now that when we talk about any kind of injury and repair to the epidermis, which is what you're talking about some kind of communication signal. So sometimes people use microneedling, you're using the needles to create those microchannels. We use a laser, and I know you love lasers, so do I. But we use LaserMD Ultra, which is a thulium laser in a 1927 wavelength. And then you just use the laser to gently create these microchannels in the epidermis. We use that laser for everything. We love it. And when we can put something like KeraFactor on the top of to grow hair, it's amazing. Like, I love that
I'm glad
machine. So
I'm
tell me,
glad you said that. I don't know if you know this, but I helped develop that laser in 2019. So
did,
that's my baby.
well, we have two of them and they are on
So
all the
I'm
time.
very happy to hear
Yeah.
about how happy you are about your Ultra
Yeah.
because it's my favorite laser too, still.
Yeah, we use it all the time. And in fact, I sometimes will push my staff because I love the aesthetic piece of it. I do a lot of
Yeah,
wellness and sexual wellness, but love the
yeah.
aesthetic because I love lasers. If you're like a little geeky if you like lasers, you're geeky no matter what. Because when you talk wavelengths and electromagnetic spectrum, some people will zone out. But I will say, that with that one, just the fact that you can almost do everything and you can do things that even my staff isn't aggressive enough to treat, like AKs, like age
Yeah,
spots
that that's
yeah.
that's what we developed it for. We developed it to be ultra for ultra utility. That laser was designed, nobody had made a 1927 nanometer laser. Like, of course, Fractal had a 1927 nanometer laser, and everybody looked at me like I was crazy when I said I was going to develop a 1927 nanometer laser. I said, "There's so much you're missing out on. This laser can do so much more than what you guys are doing. You guys are just treating like pigmentation and stuff like that. There's so many more things you can do. Make the spot size bigger, make it go a little bit deeper, have it affect more collagen." I don't know if you know this, but the reason why the laser, the 1927, is so good at absorbing KeraFactor or any topical product for that matter, is the laser is water absorbing. So it actually boils the water that's in the intersection between the epidermis and the dermis. That's why you get epidermal dermal separation when you use the laser. That's why the epidermis peels off later. But for the purposes of topical delivery, those the boiling water, those steam bubbles go through the epidermis and make these beautiful little sponge-like channels that allows those nanoparticles to get absorbed into. And so the skin stays completely intact, but you've got these little shoots that have been created by this steam bubbles that have come out, and that's how the care factor gets in. So it's actually, talk about geeky. It's very cool that you use this laser that doesn't go too deep. You can use it for 50 other different things, but when you use it on the scalp, it doesn't go too deep on the scalp. So you're not going to scar the scalp in somebody who has poor scalp health. You're going to create microchannels that are created by little steam bubbles, and there's no downtime.
And there's no pain.
Yeah, exactly. And if there is pain, you know for a fact you're going too deep. Because if somebody feels pain, you're in the dermis, and you don't want to be in the dermis. You want to stay in the epidermis.
Yeah, and I've had this treatment done many times and without any numbing, and it isn't painful. Where microneedling can be, for those offices doing microneedling. To me, we still have reasons to do microneedling or are microneedling for certain things. This wouldn't be
Of
one. The
course.
LaserMD does so much. And again, when you can use the laser and heal from the inside out, even for, aesthetics and face, why wouldn't you do it? Because you get to the point where you just said you peel later, but you don't peel for days and you can actually get great results with just about anything. But anyhow,
Well, the other
back.
thing is consistency. So what I would tell your viewers is I would say that the reason why you're so successful is the person who's microneedling, how deep are they? Are they pushing? Are they doing it very lightly? Um, are they using a different type of laser that maybe penetrates differently? When you use your LaserMD Ultra, it's consistent throughout every single patient that you treat. KeraFactor as a product is consistent. It's the same product. It's made the same way every single time. It's consistency that is the key here. It's the fact that over 90% of our patients get over 50% increase in hair density in the last study that we just showed. I mean, this is double or triple what people see with minoxidil, and they think that we're making it up. It's just not. It's that consistency that is the key.
What was the percentage with that last study?
So the last study is going to show over a 50 to 70% increase in hair count at 4 months, and an increase in 70 to 100% increase in hair mass after 4 months. And that's using a combination of the LaserMD Ultra with the KeraFactor MD solution and that laser cap that photo activates the particles inside the KeraFactor MD.
Well, so bringing us to the cap, because before we got on online or on the camera, I was asking you questions about it because I want one. And kind of I'll, do videos of it and what it looks like. It looks amazing. So tell me a little bit about the cap.
So one of the things about this is one of those things that when you're a geek, laser geek like me, sometimes you have one of those light bulb moments. And so I was researching a compound because what I found our first generation care factor, as much as I told people that you have to be stable in your hair loss, what I mean by that is you should never start KeraFactor or a product that's designed to help you grow your hair if you're in the middle of a shed, because it's like it's like swimming against a tsunami, right? You've got to get the stable loss. So you've either lost the hair and now you're stable, or you've taken a DHT inhibitor of some kind or anti-inflammatory that's reduced the loss of the hair. Once you do that, then you can come back, and that's where you want to be. You always want to be in that particular stage. So you always want to make sure that you're dealing with stable. And then what happened is we found that a lot of our customers, they weren't really regularly using or didn't want to use the drug. They didn't want to use the dutasteride. They didn't want to use the finasteride. So my wife, being my wife, said, James, you better come up with something. And so I started researching a non-drug compound that happens to be the color of my shirt. We call it a nanofluorosome, which is actually a derivative of turmeric. And that's where that yellow color comes from. And you'll know that with the yellow color that you see when you use your KeraFactor. Now, that yellow is actually fluorescent. And it turns out that in a study, it works really, really well at getting rid of DHT and inflammation, but it also turns your scalp yellow. So what we did is we nano encapsulated it and we reduced the concentration to a point where it wouldn't stain your scalp. But then me being a laser guy went, well, we've got to activate it now. It's fluorescent. And people already have these caps. They already use these red light laser caps, the diode laser caps. Well, red light is the second highest peak of absorption to activate dimethyl curcumin or the curcumin that's in there. So we just stumbled upon this perfect 1-2 punch that, well, you're already using the cap. Why don't you photo activate your KeraFactor and stimulate and make sure you get more anti-inflammatory properties, more anti-DHT properties from it. And we just launched a cap to add in the 830 nanometer, which is pure infrared light. And that was added because of circulation. Because if there's one thing that I would tell everybody, that's a free advice, is circulation. So if you can keep your scalp and healthy, get healthy and keep it circulated, and it gets nice and pink when you rub it, you know you got good circulation. And every one of your KeraFactor patients, I guarantee you, if you measured how much they got red when they began their treatment, and then look at how red they get in their scalp 3 months into their treatment, they'll get bright red instantaneously. Especially if you're using the laser, you'll do a couple passes the first time. Second time, you'll do one pass and you'll see they'll be pink straight away. And that's rehabilitating the scalp. And that's what really makes the hair grow.
This is all great information because when I would look at the cap or caps, because I have patients that will ask, what do you think
Yeah.
about the laser cap? And honestly, I hadn't really looked into it. until I saw your cap. And then when you look at the wavelengths, because there's 3 in the new launched cap, right? Where you have
There's two, 650 and 830 duo.
okay.
Yeah.
And
Yeah.
then the 830, is that right? Was
Yeah.
at,
It's 808. It's basically the same thing.
but it was added in to get
Yeah.
deeper penetration
Yes,
because
and
of the infrared.
increase circulation specifically. So 808, which is an infrared wavelength, has been used for the last 60 years to treat inflammation, chronic inflammation, and so adding that to the already powerful red light, which is the 650 nanometer, which is proven and FDA approved for hair growth. So that cap is already approved for hair growth. Now you add the 808, you get that extra anti-inflammatory properties, but you get the extra increase in circulation.
And it's interesting because I wouldn't have guessed, like, so knowing that lasers like you do, because I think that we get probably the most traffic to our website on a blog I wrote way back that talked about the difference between red light and infrared,
Mhm.
because I didn't know the difference at the time. So if I'm going to search through it, I would just type something up. And so it was pretty much in layman's terms for me to understand too. And we have a ton of traffic with that. But if you wanted to just confirm, so like in the electromagnetic spectrum, when you're talking about red
Mhm.
light therapy, you're talking about a visible spectrum. And
Correct.
then
Yeah.
infrared is a longer wavelength that goes deeper. So you get more systemic effects, even if you're doing infrared, than you would red light, right? And you may want to add.
Depending on how long you put it on for, if I left the cap on for 30 minutes, they're using that for basically for stroke patients because again, it's a circulatory thing. So, the lasers can penetrate very, very deeply, but it takes a long time. So our cap is on for 6 minutes because that's all we need to deliver the dose that we require. But these lasers, you're going to see a lot more use of them with other applications, specifically around things like stroke and others. So that's going to be more of the infrared. But the visible light, the red light, that doesn't penetrate very deep at all. That penetrates, you know, I tell you a little thing. The reason why we see our blood vessels as blue is because of the red light, right? Because it gets reflected by by your hemoglobin. That's why we see it's got nothing to do with oxygenation. It's all to do with the wavelength. So 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 that red light basically penetrates a couple of millimeters into your skin, but it has beautiful effects where it does get absorbed and reflected by hemoglobin. And that means it does increase local and cause a localized increase in circulation. And it's also something that is absorbed very readily in hair. Because guess what? We use those wavelengths for hair removal. So we
Mhm.
know that those wavelengths go down deep enough to treat the hair. But if we want to go one step further, we go into the infrared spectrum. So less absorption, but deeper penetration and more circulatory effects.
Because that's a big, um, pe- people don't, it's a lack of understanding. And there's lots of questions out there about that visible light, like red light therapy versus infrared.
And please also notice it's very important laser versus LED. I'm sick of seeing these companies talking about LEDs versus laser. That's like talking about IPL versus a laser. Okay. An LED is not a laser. It's a light emitting diode. It is okay in certain circumstances, but if you want the deepest penetrating, the highest specificity, you need to be buying a laser. Do not buy an LED. You're not going to get the efficiency that you get from a laser. You're not going to have a 6 minute treatment to complete with an LED. You're going to be there for 30 minutes, 40 minutes, or something like that.
So for us very simple chicks that don't understand a lot of that, and I learned a lot about lighting, not lasers, but lighting, just building out my new building. But if they don't see a wavelength, then it's not a laser. Is that a safe thing to say?
Um, Well, unfortunately, we have a lot of people in our industry that don't tell the truth all the time. So, um, a LED can have a peak wavelength. And so, what they will do, these companies will say, I've got 630 and 830 and 685 and whatever, and they're LEDs. And what they're quoting is they're quoting that wavelength is more than 50% of the energy that comes out of it, right? And that's how it's determined to be a laser diode, and it's not a laser. Whereas a laser that says it's 650, 100% of the light that is emitted from that laser is at that particular wavelength.
Gotcha.
So you will find people will market the nanometers, but make sure you look for diode. Make sure you look for laser. If
Hmm.
it says light emitting diode, that's not the same as a laser diode.
So the big difference is light emitting diode or LED,
Yes.
not for your hair. For your office, maybe, but not your hair. Not
Unless
aesthetics.
you
Yeah.
want to hang around with a laser cap on all day, every day, then yeah, avoid the LED.
Well, that's important to know
You
because I
you
think,
basically get more red light from the sun. Like legitimately, I'm not joking. You could actually go outside right now, or if it's sunny outside, and as long as you had sunscreen on, go outside and you'll get more red light from the sun than you will from the LED cap.
wow. And so, yeah, no, that's important to know. So do you recommend well, number one, before we get off the cap, 6-minute treatment because of the addition of the 810 wavelength and the infrared? Did
And
that cut down?
the number of laser diodes. We have 302. So it's a combination between the power, so 5 milliwatts per laser diode, the number of laser diodes, and then the combination with the 808.
Okay, so 6-minute treatment for that, and it's medical grade,
Yes,
tested, all that. So,
absolutely.
and then do you guys have topical product after, like, so obviously we use KeraFactor with Carelase,
Mhm.
or with the LaserMD Ultra. We call it Carelase is the actual treatment. The machine
Mhm.
is, the LaserMD Ultra KeraFactor, and then we give them that to take home. But tell us about topical products they can use in between treatments, and then how many treatments typically
Yeah.
patients are getting.
Well, so we sell, and you can also sell if you like, or have an affiliate site. We sell a oh look, I've got one right here. We sell a serum, which is a take home. So think of this as like microdosing your your care factor. So everything that you give the patient at the time of the treatment, just bear with me while I pull it up here. This is what you give the patient during the treatment, right? Everything that's in here is in here, but it's at a lower concentration because there's 50 ml of this, so it's mixed with more water. And so the idea here is that when you every day post treatment, you do a little bit of this every day. Do a little bit of this every day, do your laser cap 3 times a week, and that's gonna be the best maintenance that you're ever gonna do. When you do the 2 things together with the treatment and that's gonna get you the best results. Are they gonna be different results? No. It's a matter of time. If you do the treatment at the office and you do the take home, solution, and you do the shampoo, and you do the massage, you're gonna see results faster than anybody else, and they're usually gonna be between month 2 and 3. If you're just using the take-home products, it's gonna take about 6 months for you to notice results. If you're doing the treatments, it's gonna take about 3 months. Around about the 3rd treatment is when people really start to they feel their hair, it feels like kinda like rough. That's all that thicker and new hair that's coming in. Takes about 3 months. So, everything produces results. You don't have to buy the take-home products. I'm not forcing the take-home products on anybody. I would never force a product on anybody. All it does is it helps you maintain your results, and it will get you a result a little bit quicker because you're dosing yourself with a little bit more growth factor every day.
Okay, that's great information. I always say it's not a one and done. I think in the aesthetics field, we've kind of set people up to think that there's a one and done. So they'll come in and they want like a Fraxel laser and they want this magical before and after. And so I just say it's a slow commitment and consistent commitment. And then it's an investment over time that you will see amazing results with. But I agree with that fully, that you still want to be committing over time and don't expect a magical overnight,
Absolutely.
result.
This isn't Miracle Grow as much as I want it to be. It's not Miracle Grow. And the other thing I would say is that we do have longevity data. So we do have people that have not used our take home products and they have seen results that last over 9 months, and they have lost less than 1% of what they've gained. So that's basically like you gained 10 hairs and you only lost one, okay, in 9 months. So there's longevity data that we have. But of course, if people want to maintain, just like using their skincare, just like using your sunscreen, you want to use it every day, or if you're in the sun, the more you use it, the more you're going to be able to keep your hair in the form that it's in for the longest period of time.
Okay. And your free tips again were what? Your free tips
My
were
free tip, my free tip, hot water when you wash your hair, scrub the hell out of your hair. Give your scalp a good scrub so you see it get pink. If your hair gets pink, that means blood's coming to the surface. Blood is red. When you see that redness, by the way, this is a tip for your face as well. And it's also a tip for cellulite. If you have cellulite, here's another tip, free tip. If you have cellulite, rub your legs during in the shower until you see them nice and pink. That keeps the circulation there. Circulation is the lifeblood. That's like watering the grass. You got to have circulation. That's the free tip. Or keep circulation there. You're going to keep your hair as healthy as possible.
So, do you, because hair is like a hard thing to, meaning you want nutrients, blood flow, all these growth factors with it. Is there's supplements like or anything nutrient wise that you think is super important for hair growth?
There's plenty of companies that will sell you hundreds of dollars worth of pills that do something. You know what the best thing to do is? Go into CVS, buy yourself some hair, skin, and nails. 90% of what you can get, what 90% that's going to have an effect on your hair is going to be hair, skin, and nails, or some hair, skin, and nail formula from a CVS or a Walgreens or something like that. Sure, if you want the ultimate, you can go and buy your Nutrafols and your Viviscals and all of those different ones, and they are better. Don't get me wrong. I'm not poo-pooing them at all. They've done a lot of work. They are effective, but they're also expensive. And you can get 80 to 90% just from getting your hair, skin, and nails from the pharmacy down the street.
Will do. We would, so I like to look at that as like you need to get nutrients. You need to get hit hair from every different angle. So, like we're talking about topical, ongoing, in the office treatments, LED. We actually factor our Nutrafol right into the treatments so that
Yeah,
it's a 3-month supply with their treatments because a lot of patients really love that. And I like medical grade stuff, period.
yeah, of course.
But for
And
that
you and
reason,
by the way, personally, Nutrafol's the best from my perspective. Nutrafol as a formula is the best out of all of the different ones. So I would totally agree with you on that.
and I just look at it more or less like some nutrients. I didn't know if there was one in particular, but honestly, I just say, hair, you want it healthy. And so, like, if you can get the nutrients in, but you actually have to hit, that local regeneration too, which is what we're talking about.
Mhm.
And that's super important to go right to it. And a lot of people that use that oral finasteride with, sexual issues and that we deal with on a regular basis, and they're taking something topical like even minoxidil, or not topical, but orally with side effects. And you really
Yeah,
want it to be topical anyhow. So this
yeah.
is healthy and natural and not a medication and no side effects. And you said no
That's what we
downtime.
wanna try and avoid. Science is good enough now that we can mimic the stuff that your body already produces. We don't need to get a drug to irritate something in your body to stimulate your body to do something. Eventually, I'm not without disclosing our company's secrets, but eventually, years from now, we will have worked out a way to put a product that is natural, that is on the scalp, that will deactivate just the follicles that are DHT sensitive. That's the future. The future is to be able to get early. So KeraFactor is not going away because you always want to have the thickest and most hair, and you need those growth factors for that. But the key to stopping the hair from falling out is going to be able to stop the DHT sensitive follicles from being DHT sensitive. And that will be a polypeptide compound of some kind many years from now, that will basically tell your body to don't worry about that DHT, just tell it to go away. And that'll be the future.
Well, that's awesome because, again, as we know, it doesn't have to be elevated in the bloodstream, but it can concentrate in that hair follicle. So, well, I love it because I'm all about the regeneration and doing things. And I think that patients are actually finding us and then finding, KeraFactor and the peptides and all the growth factors because they're looking for non surgical and non medicine options. And so, that's why I was kind of curious because everyone's also talking about like hair transplants in Turkey and
Yeah.
all the places.
Yeah.
You have any
Oh
comments on
God.
that? Because I have
The
that asked every day
the
too.
turkey line that you all come back looking the same way. Yeah. Yeah. Yeah.
But it was obviously very informative. You do a great job of explaining the science behind it and breaking it down to very actionable steps. And I always have said that the world would be a better place with more scalp massages. So maybe we just need to add that on as a service, like on an ongoing basis, because people are more relaxed too. And so that would be a simple at home trip or tip to
Yeah,
do. But
buy our if you get our combo kit, it comes with a little nice hand massager to
oh,
massage your scalp in the shower, so you get it for free.
well, you
In the
thought of
combo
everything.
kit combo if you go and buy the combo kit, you'll get, one of these, which is your daily, solution. You'll get your shampoo, and you'll get, a nice little scrubber that was designed specifically to get the circulation around the follicles as much as possible.
Well, that's awesome. You've thought of everything. Does anyone ever complain of the topical on a daily use that it makes their hair
No,
greasy or dry or
they don't
anything?
actually. I've had one complaint in, what is it, over 10 years, and the complaint was, the lady the cat her cat was licking her forehead, and she wanted to know whether our product was cat safe, and we said we prefer that her cat not lick the compounds. So that's the only bad feedback I got. I got lots of positive feedback. We made this basically water. This is not sticky. As you know, you've used the product. It's not sticky. It has no fragrance in it. It has no oil in it other than
Mm,
the nano encapsulated oil that you will never feel. It
mhm,
dries dry. You can style your hair immediately after. As soon as it's dry, you can do whatever you like. Takes
mhm.
3 minutes to dry. It's really designed to be inert, and
Okay.
that's what all products should be. You put them on, and they should be completely inert once they're done.
And it gets right to the epidermis and the scalp, which is right there. So daily use works.
Exactly.
So
Yep.
I guess the summary then is again, this care factor is a topical and proprietary, specialized, customized topical peptide and growth factor that you can use by itself, or you can actually use it with a provider or an office that does some kind of, and again, I love the LaserMD Ultra, microchanneling with lasers to help with that delivery. Still do it on a constant daily basis in that cap 3 times a week. And that's the more recent study that's coming out that shows a, greater than 60%, you said, or
5 times higher. We're gonna publish something that's gonna show 5 times higher than using minoxidil without any shed.
okay. Yeah, no, I cannot wait to see that. And then we'll send everyone to the results. But this was a great podcast, so informative and exactly what our patients are looking for. And so, if you have hair thinning, which is so common, 50% of men, 40% of women, especially as they get older. And so, it affects our confidence every day when you walk out. People are thinking about it. So, if you had that issue before, I will just ask before we close is your hair looks great. Like everything looks great. And
I
so,
Thank you. Well, it's all KeraFactor.
yeah, if you've had thinning, it's not obvious. And then your eyebrows look great too because you guys have a brow product
Yeah,
and a
we
lash
we we
product.
we decided to make we don't have time to talk about it, but we maybe next time. We designed, my wife challenged me. She said, "These prostaglandin products are causing my friends keep on complaining about Latisse doing this or this lash factor doing that to changing my eyelid color or changing affecting the fat in the eyelid." And she said, "You think you can make a lash and a brow product without any prostaglandin?" And I said, Yeah, of course I can. So that's what we have, a lash and brow product. It has no prostaglandin, no analog. It's not one of these companies that disguise what they're doing. They usually disguise it under like Mirasol pentapeptide something 17. This is an absolute 100% human synthetic SH polypeptide growth factor product for your lids, for lashes, and for brows.
Well, I have it on the way. Actually, I think I just received it because
Let
again,
us know how you go. Let Laura
oh,
know how it go,
I
and
plan
maybe we
to.
can talk about it next time if you want.
I think that would be perfect because that is something that our patients want to and are seeking. So, well, perfect. Well, thank you so much, James, for being with me today. And again, if you guys have any questions, drop them in the comment, open up those conversations. And I look forward to our next podcast.